The following portion of Bloom is sponsored by Central Florida Behavioral Health Network and the Department of Children and Families.
Welcome back to Bloom. There's a need to provide support and community in the journey to recovery for people who may struggle with substance misuse and their families alike. Here with more is the president and CEO of Central Florida Behavioral Health Network, Alan Davidson, and the executive director of the Recovery Epicenter Foundation, William Atkinson. Welcome to Bloom, gentlemen. Thank you so much for being here.
Thanks for having us.
So, Alan, we'll start with you. Central Florida Behavioral Health Network is a managing entity. Explain to our viewers exactly what that means.
Yeah, sure. So we're a managing entity. We're one of 7 in the state. So we cover a lot of counties here in the state. So from Pasco County down to Collier, over into Hendry and Glades, and up into Polk, Highlands, and Hardy. We're the largest managing entity in population and the 2nd largest in landmass. And we cover a variety of services from crisis care to care coordination, mobile response teams, detox. And one of the providers that we fund is Will Atkinson and Recovery Epicenter, and a lot of like peer-related services.
So tell me about Recovery Epicenter. What do you guys do?
So we are a recovery community organization. We got founded in 2014, recognized in 2017 by National Faces and Voices of Recovery, and became the first RCO to achieve a subcontract with Central Florida Behavioral Health in 2021.
So you guys really hit the ground running and highly recognized for the work that you do. So tell me, what is the Recovery Epicenter when it comes to unique management of substance abuse? Because I know your programs differ from the rest.
We try to focus on prevention through life-saving medications like Narcan. We do a lot of distribution efforts throughout the community in Pasco and Pinellas. Going up and down major highways, making sure that bars, clubs, hotels, gas stations have Narcan present. The idea is to, when people visit Florida, we want them to have a good time. We want them to go home and survive.
And we're finding out and doing a lot of coverage here on Bloom that people are exposed to fentanyl even when they're not even looking for it. You know, it's laced in all different kinds of recreational drugs and some legitimate drugs that people are like, oh, here's an Adderall. So having, you know, Narcan on hand is saving lives. I mean, we're seeing overdose rates drop.
Well, and thanks to Central Florida Behavioral Health and the funding that they provide, since 2022, at the highest peak, we've seen now overdoses continue to rise, but the deaths are dropping.
And Alan, you and I talk about this all the time. I mean, your strategy of working with all of these agencies together is what makes a difference. Because, you know, one institution can't do it alone. Right. So you're reaching out to people that are leaders in the industry. Absolutely.
So, you know, a person might start here with Will and Recovery Epicenter, but then might move into kind of deeper in services with outpatient and med management at like an Operation PAR or like a West Care. So it's that network of providers that actually get someone into full recovery.
Yeah, it's a brilliant idea. That way people don't get lost in the system because you can direct them exactly where to go.
Yep, absolutely.
All right, thank you both for being here.
Thanks.
For more information on Central Florida Behavioral Health Network, visit help.hopeforsuncoast.org. And for more recovery support information, you can visit recoveryepicenterfoundation.org. Bloom will be right back.
The preceding portion of Bloom was sponsored by Central Florida Behavioral Health Network and the Department of Children and Families.